Hi, you guys. Welcome back for our daily practice questions. It is day 91. And as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Also, if you're looking to join the upcoming 5-week review that starts on April 21st, be sure to click the link so that you can enroll. All right. Question number one states a 65-year-old female patient presents to your clinic with complaints of pain and stiffness in her fingers, especially in the mornings. She mentions that her symptoms have gradually worsened over the past few years. Upon examination, you note small, bony nodules at the tips of her fingers. She also has some limited range of motion at the distal interphalangeal joints. Based on your findings, what is the most likely diagnosis? Is it A, rheumatoid arthritis? Is it B, gout? Is it C, osteoarthritis? Or is it D, psoriatic arthritis? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, based on your findings, what is your most likely diagnosis? And y'all know I tell you, if they're asking for a diagnosis, you need to run it back and look at the assessment findings. So what are their signs and symptoms? How are they presenting? What is noted on exam? And also, I always say pay attention to these three findings if they are included, being their age, gender, and ethnicity, as that can contribute to determining a diagnosis as well as how to treat, right? So we have a 65-year-old female. She came in with complaints of pain, stiffness in her fingers, and is noted more in the mornings, right? She mentions that her symptoms have gradually worsened over the past few years. Upon exam, you note small bony nodules at the tips of her fingers. She also has some limited range of motion at the distal interphalangeal joints, right? Y'all, this is classic for C, osteoarthritis. Main things to pay attention to with osteoarthritis. She mentions that it's more stiffness in the mornings. She states that her symptoms gradually get worse during the day. So remember that osteoarthritis is also known as degenerative joint disease, right? So because the joints have basically worn down over time, the more you have to use them is when they begin to have more symptoms as well, right? So they may feel more stiff in the morning, but they also gradually worsen symptoms as their day goes on. Then also with them, they're describing here Herbeden's nose as well, which is associated with osteoarthritis. So C is your best answer. All right, question number two. A 58-year-old male presents with pain and swelling in his fingers, particularly at the middle joints of his fingers, and has a history of increasing difficulty in gripping objects. On exam, you observe bony enlargements at the proximal interphalangeal joints with no redness or warmth. Which of the following physical findings is most likely associated with the patient's condition? Is it A, Herbeden's nodes, B, Bouchard's nodes, C, symmetrical joint involvement, or D, subcutaneous nodules? Take a moment and tell me what you got, y'all. All right, so stem of the question states, which of the following physical findings is most likely associated with the patient's condition? All right, so let's run it back and see what's going on here because this is really asking you on a diagnosis standpoint, right? So we want to look at those assessment findings. So this 58-year-old male comes in, he has pain swelling in his fingers. They're particularly at the middle joints of his fingers. And the enlargement are the proximal interphalangeal joints. Y'all remember these nodules that are proximal versus distal. Proximal is Bouchard's, right? Remember BP, B for Bouchard's, P for proximal, and then Herbedens are distal. So HD for that. H for Herbedens, D for distal, right? So your best answer is B, Bouchard's nodes. All right, and lastly, question number 3. Which of the following is most commonly associated with Herbedens nodes in osteoarthritis? Is it A, they occur at the proximal interphalangeal joints? Is it B, they are indicative of rheumatoid arthritis? C, they occur at the distal interphalangeal joints? Or D, are they typically found in patients younger than 30 years of age? Take a moment and tell me what you got, y'all. All right, in this scenario, the stem is the question and the question is the stem. And if y'all are paying attention, you ought to get this one. So it says, which of the following is most commonly associated with Herbedens nodes and osteoarthritis? Herbedens is what? It's distal, right? HD, right? HD. H for Herbedens, D for distal. So your best answer is C. It occurs at the distal interphalangeal joints. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number 1 at gmail.com. Everything that I offer is linked in the bio of this channel. And as always, if you're looking to book any of my one-on-one sessions, any of my custom packages or plans, or any of my question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.